Hello again. Well, it's true, as one wise old sage extolled in the surgery this week. We seem to have leapt from spring to autumn, missing out summer altogether this year. At least compared to last summer, which seemed for all the world to be just an extension of winter, from a general practice point of view, in terms of we were all having issues ongoing from the list of COVID restrictions, with wall-to-wall viral infections and other things affecting all age groups, coupled with, of course, still too much COVID. Some tiny slivers, then, of good news. Though in the midst of all this wind and rain, there is some good news. Less hay fever, less insect bites, less sunburn, a crumb of comfort. We've all had that stress of A and O-level results now resolving, hopefully in an okay fashion. Then suddenly it's back to school. Can't believe it. A case of paralytic polio in Gaza. A grim reminder that given the right circumstances, such viral infections caused by a lack of decent sanitation mainly will flourish. Mainly affecting young children and infants, this is truly shocking. As a child, these were the words I could recall: iron lung and calipers, which were commonplace in society pre the advent of polio vaccination. I've personally seen the long-term effects of paralytic polio whilst visiting India. Beggars dragging their floppy, withered lower limbs along, these little trolleys, holding their silver sort of cups. Truly awful and completely avoidable, making the whole thing just worse. Now, on the island, we've always had lots of patients desperate to lose weight. In the olden days, it was calorie counting or controlled diets and exercise, morphing into, for example, more specific regimes such as Weight Watchers, Atkins diet, 5-2 diet, potato diet, cabbage diet, Cambridge diet. Much of this was, of course, channeled into discussions in the surgery, and particularly if folk had ongoing medical conditions that would have benefited from simple weight loss. Today it's so different. We're meeting so many patients who have used their own online world to delve into weight loss regimes completely outside the NHS. Be it a trip to sent elsewhere, e.g. Turkey or similar, for a variety of bariatric procedures, or any number of different types, flavours and strengths of so-called skinny jabs. I can only say this as none of this is basically any of our business, of course. However, many of these therapies can have significant health outcomes attached to them outside the much wished for weight loss, of course. The NHS can seem a clunky place sometimes to find whatever it is you feel you need. But we shouldn't take for granted easy suggested monitoring such as blood tests, ex-surgery abroad. Who manages the problems then that may arise if your consultant is thousands of miles away? Skinny jabs have become very popular, of course, of late. It's not surprising. Readily accessed without any NHS interaction or prescription online. The worldwide shortage of these medications sort of easing for some brands to a point anyway of late. Some years ago, liraglutide, aka Victoza, arrived as an add-on, usually in the treatment of type 2 diabetes. It was one of these injections you had once a week. It was one of these first medications termed GLP-1 mimetics. They mimic a naturally produced body chemical, glucagon-like peptide 1. This works on several receptor sites, mainly nothing to do with the gut, but essentially GLP-1-like medications slow stomach emptying. They make you feel like you're full after eating very little, very quickly. They reduce your appetite, as well as your insulin sensitivity, which goes up. A critical action keeping your blood sugars down. Over the past couple of years, though, additional more potent GLP-1s have arrived, and some of them are extremely potent. And as ever, our onlines are keen to lose weight souls, have been busy getting a piece of this action. We now have some leaders in the field to lighten the scales. Semaglutide, also known as Ozempic or Wegovy, being one. Then the very latest kid on the block, Tirzepatide or Mounjaro, which is more potent still. Over a year, several stone can be shed with use of these agents, originally, of course, for type 2 diabetes, moving into obesity for those with a BMI of 35 or 27 if you're from a variety of Asian origins, or have additional risk factors, e.g. heart disease and all the rest of it. That's some indications for some of these medications. As Ever, there's lots of no-goes and listed carefully in the sheets. There they are. Then, of course, there's the cost. Online, these are very expensive medications, running into hundreds of pounds monthly. And, of course, once stopped, all returns to whatever normal was. It's always useful, though, please, 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 if appropriate, to let us know if you see your GP, if you're using any variety of these medications, particularly if you're on prescribed normal NHS stuff. Please, 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 have a look at this month's Which magazine too. There lies in a very helpful article on this very subject. So, that's a bit of stuff this week. Until next, cheerio.